Hello, everyone. Welcome you all to the fourth episode of Self-Love Recipes. We'll discuss all about fat reduction today. Please send in your questions. We are here only to answer your questions. Whatever doubt you may have with regards to any diseases. Hi, Karthik. So, viewers, now the main goal of this self-love recipes is that most of the time we do get clients who come in with expectations of wanting to reduce fat. It can be either from the chin or it can be from your saddlebags, meaning lateral thighs, lower belly, anywhere, right? So sometimes we have someone who's on ideal weight with good diet, exercise program. But we also get people with overweight and obese category also thinking that the same procedure which helps with minimal reduction can also help them. So we'll start with that. I'll start with Dr. Ashish. We'll start one by one. We'll start with double chin correction. So Dr. Ashish, let's discuss about all the options that's available for double chin correction and because I think that's one of the commonest procedures where most of them do drop in and ask us they want to correct the double chin. So we have lipodissolve or injectables. We have some non-surgical devices. We do have surgical options. So please tell us what would suit which candidate.
Yeah, thank you. As you rightly said, that double chin is one of the commonest problems that people face. And primarily, there are two categories of people. One, obviously, those who have started putting on weight and they tend to have a fat storage in the under chin area. Now, that fat can either be stored right under the skin or it could be stored deep under a muscle called platysma in the neck. Now, clinically, we have identify, and if it is under the skin, then that is something that we plastic surgeons can help with superficial treatments to tackle. But if it is deep, then it may need more invasive treatments. Of course, plastic surgeons, we can tackle that too. But first is identifying where that is. Second is what is the quality of the skin, whether it's nice and elastic. Once you have removed the fat, the skin needs to contract and redrape well. So from that point of view, we then have to look at what is the lifestyle of the patient. Are they eating well? Are they on a journey where they are able to maintain their weight or reduce it? If they are like that, then yes, our treatments will show some long-term benefits. If their weight is constantly going up and you do something, I mean, they're just going to reaccumulate somewhere else or maybe in the same area. So once you have clinically ascertained that the fat is just in the pinch where you can hold, then if it is mild, you can suggest a non-surgical option such as you rightly said, lipodissolve or lipolysis, called injection lipolysis. So it's a US FDA approved technique where you inject a product called phosphatidylcholine, and that helps in dissolving the fat. It has to be injected in a grid pattern at constant intervals of 1 centimeter between the jawline, and it takes 3 to 6 weeks for the fat to first swell and then dissolve and get removed by our body. Once that happens, the skin will start tightening up and you see an improvement. I mean, one injection session may be enough, or you may have to repeat it at 4 months interval. But 2-3 intervals like that can help in reducing mild to moderate fat excess in the under chin area. If there was more fat than that, and and sometimes it's extending slightly up onto the lower jawline, then I would recommend liposuction to them. And if done very well in skilled hands and in the right plane, then you can avoid damaging any of the deeper muscles and just take out the fat moderately, not too much in excess either, and get a fantastic result. So that's how I would guide. And of course, you have to guide them about their diet and exercise routine, and continue to lose their body fat percentage, and they'll do well.
Thank you, Dr. Ashish. Karthik, you do a lot of liposuction for, I'm sure, even for double chin. So what's your experience? Does all of them are happy with the result? Where do you find difficulty? What's the post-operative protocol that you follow? Because I'm sure our viewers will want to get it done, but they want to go back to work the next day. They don't want to wear the compression garment. So how, for the great result, how long do they have to wear the compression garment? Or is there a role for neck lift as well in patients who double chin is contributed by excess skin as well?
Yeah. Thanks, Dr. Ashish. You finished most of the work of the non-surgical side, but still, I want to add a few more things. Even that, I think full sculpting comes with the small, small, what do you call, the handpiece for the small areas. The full sculpting is one of the options, and there is one more option. The Excel is the radio frequency and ultrasound based machines are available. So what normally I do is sometimes I don't go with only the postoperative choline. I'll combine these machines as well as the postoperative choline, like with combination sometimes, because like non-surgical results, we are all surgeons, we always start seeing the best result by surgery, but non-surgical things to convince the patient for happy, make them happy is little difficult sometimes. So we combine multiple modalities to get the double chin correction with the non-surgical, and same time surgical. See, initially my thing is most of the times I do only liposuction and tends to get the results. You believe me or not, most of the females coming to us is middle-aged, and the other group is the youngsters. See, what I found in the middle-aged is when we do liposuction alone, we also felt that, okay, swelling is there. It will take some time. It will take some time. Sometimes it never goes down. I was wondering what is the mistake I am doing, and keep analyzing my results. And I found out we are missing the subplatysmal fat, though clinically we see and we try to, tighten the neck muscles and see how that, where is the plane of the fat. But these resistant cases, I again opened up and I check. When I went to the subplatysmal plane, I found a lot of fat underneath. So nowadays, what I at the same time, most of the time, the double chin is not only the double chin, it's a chin deficiency also, because they tends to miss the chin deficiency. What happens is the chin projection, unless otherwise you give the chin projection, how much ever you remove the fat, they won't be happy. So nowadays, what I do is, if I do sometimes ultrasound to find out if I have severe doubt after my clinical examination also. If I found the subplatysmal fat is more and chin deficiency is there, I never hesitate to make the cut and do the chin implant as well as the subcutaneous as well as the subplatysmal fat by my the neck incision. But sometimes one more thing, what I normally do is, after the opening, doing a liposuction is so controlled. You see, sometimes when you do the power assisted and when you go and remove the subdermal fat, it looks a lot of irregularities in the skin level. So if I open and, with the visual thing, I do the liposuction, I feel it's much more comfortable than doing a blind liposuction. But still, younger patients, I do only liposuction, they get a good results. But after 30, I feel the liposuction alone, in my hands, not a good result. So I always combine both the things together. So one more thing is that the post-operative compression garments, very difficult. That's the only reason a lot of patients, they don't come for the liposuction of the chin, because if you say 10 days itself, they are little hesitant. But actually speaking, 2 weeks compression garments only gives a better result, because neck swelling takes a lot of time to disappear in Indian skin. So I always advise 2 weeks compression garment. After that, also night compression garments for 1 or 2 months, because this neck swelling takes a lot of time. But if you do then only I ask myself, as I said, no, initially I thought that because of the swelling only, you are not seeing the result. We wait for 2 months till they come back. So my post-operative advice is 2 weeks compression garment. After that, at least 1.5 to 2 months night compression garment till the completely settles.
Thank you very much, Karthik. So the take-home message here from all the 3 surgeons, or this is what I do as well, is for double chin correction, you have multiple modalities of treatment, starting from just lipo-dissolve injections. Then we have cool sculpting or radio frequency devices of lysing the fat. We also have option of liposuction, but most of the time, sometimes the patients have fat deposit below your what we call platysma muscle, and then you will have to remove them surgically through a small opening here. But whatever we do after the procedure, surgical procedure, either liposuction or a removal of this subplatysmal fat, we do have to wear compression garment for 2 weeks. So that's very important that you are prepared to wear a compression garment, because the post-operative advice given by the surgeon is very, very important for the final result. Before we complete, Dr. Ashish, how many of these such patients who come for double chin do you offer neck lift? Because that's also an option. So which group do you offer for neck lift, and who are the candidates?
Neck lift I would offer to those who have significant laxity of the skin. And when you clinically are pulling the neck skin back, you see an improvement. I mean, if you need to do this to see a good jawline, then they need a neck lift. So if they don't need a facelift at that time, then you can only do a cervicoplasty. And that procedure is called cervicoplasty, where you are making a tiny incision here to like either liposuction the fat or under vision excise the fat, and then repair the muscle so that it's nice and tight. And then from behind the ear, you tighten or take away that excess loose skin. That loose skin, if it is not going to contract, after you remove the fat, will still stay loose and hanging. So it defeats the purpose. Those are the patients I would then advise that you need some tightening, as in a neck lift.
Right.
I
That's
totally
really,
agree.
yeah.
Yeah, I
Thank
totally
God.
agree, Dr. Ashish, that neck skin has to be, like tightened. But the only thing is, the Indians, like we don't lack such as, how the Europeans and Americans, the white skin people lack. And the Dr. Ashish is a very good facelift surgeon. I've seen one of his videos, how he does the facelift. I also do the deep line facelift. And he does a lot of facelifts, and obviously he knows better than what I'm talking about. And but the Indian skin very rarely needs a skin tightening in the neck region, but yes, exceptional cases are there. But compared to the white skin, ours is little gifted in that area. Always I do the platysmoplasty also along with the neck lift. Thanks, Dr.
Yeah.
Ashish.
Thank you. So that's nice, viewers. So we've discussed about double chin. So you know the options, you know the downtime, and so you have all the options to choose from based on your lifestyle, your expectation. Please drop in your questions. We will be very happy to answer, all three of us. If you have any questions on fat reduction, you've tried some procedures and you've not gotten a result, or you had some issues, please let us know. Or if you're looking at getting a procedure done, please type in your questions and we'll be happy to take it. From here, I will move to the next common area of saddlebags. I'm just jumping I'm taking the commonest areas where most questions are thrown out in social handles. So we'll try and answer them. So I get a lot of patients coming for cool sculpting for saddlebags or the lateral thigh bulge. I do have cool sculpting we offer, but I'm not a great fan of offering cool sculpting for especially the lateral thighs. What is your take on that, Dr. Ashish and Karthik? Ashish first.
Cool sculpting is a good tool. I mean, it is a scientifically proven technology where you can reduce fat. I mean, whatever you can hold in that suction cup, you can freeze, and it reduces a significant amount of fat. But of course, you have to be mentally prepared for sessions. But what it doesn't do is doesn't tighten the skin. So these two things you have to keep in mind. And if that saddlebag fat is something that can be pinched and held, then I think it may fit in that cool sculpting suction cup. Yeah, if they are, if they want a non-surgical option and they're willing for having 2-3 cups applicators applied at the same time for a nice and even result, and they are also willing to maybe have another session in case they still find that the reduction is not significant, then cool sculpting is an option. But
Yes.
if you want to treat it, yeah, sorry. Yeah.
No, so cool sculpting, Dr. Ashish, they have specialized probes called Cool Smooth Pro for the lateral thighs. Now, the normal cool sculpting we all know is gives three-dimensional cooling, whereas where the Cool the Smooth Pro is from one dimension because it's just flat. It doesn't take in and cool from three sides. So the amount of fat lysis is less. In South, I'm not sure about the northern Indian side. In South India, the amount of lipodystrophy or the cellulite deposit in the lateral thigh is quite significant. And to use cool sculpting to get rid of them will require multiple sessions. So I normally tell the patients, considering the cost factor of two cycles on each sides, and then every 6 to 8 weeks you keep repeating the session, considering that for better result, cost effectiveness, quicker result, I think liposuction is a better option. Karthik, what's your take on that?
Obviously, one small disturbance. He wants to say hi to the viewers.
Hi. That's beautiful.
Hi. Okay. So the thing is, one more question to you, Dr. Jayanti, before I answer. When you use cool sculpting, as Dr. Ashish said, that you might have that little loose skin issue, do you combine the radio frequency also along with the cool sculpting in not only the lateral thigh areas, any other areas? You combine two modalities.
Yes, I do. What I do is I combine cool sculpting with Thermage. Thermage is a brand and cool sculpting is a brand. So cryolipolysis with radio frequency, simply because we are trying to do fat lysis and skin tightening together. So I don't do in the same session. I will do it maybe after 10 days, because during the same session, they don't feel the heat of Thermage. So after 10 days. But again, for that, there needs to be significant skin laxity and so on and so forth. If it's just going to be a huge bulge on the lateral thighs, and I normally, even though I have cool sculpting, I don't recommend cool sculpting, and I would prefer doing liposuction. We'll take one of the questions from the patients, from our viewers here. Dr. Ashish, they want to know, can fat reduction or liposuction procedures be done for diabetes patients? I think one of you can answer that.
Yeah, Karthik, do you want to answer that?
No, carry on, Dr. Ashish.
Okay. Yeah, so absolutely. Why not? I mean, diabetes is not a contraindication for fat reduction by liposuction. In fact, if your body fat percentage reduces fairly significantly with liposuction, then maybe your insulin requirements may go down. And there are some papers which have shown a metabolic improvement. You need to have your diabetes controlled. We wouldn't operate on you till you have demonstrated a good control on your blood sugar levels. If your HbA1c level is less than 7, nothing like it. That means you have got a good control, and we can definitely operate on you.
I have one more question here before we proceed with our discussion, Dr. Karthik. Karthik, they want to know if we have a fat neck, can fat reduction be done? So I also have a short neck, so there's always any live show, anything. There's always patients are concerned that this shoulder is not, so the whole neck being bulky, they want to reduce, 3-dimensional. What are the options?
I'll send the patient to you, Dr. Jayanti.
Dr. Ashish,
very difficult.
So,
yeah, that's a good answer. I don't think you can better that answer, Karthik. No, it's tough. It's very tough. If it's a very short neck, I mean, it is more to do with the structure and the way the muscles are arranged, and less to do with actually fat underneath the skin.
Right. So we'll continue with liposuction or the fat reduction on the lateral thighs. Karthik, would you like to go over liposuction as an option for saddlebags?
Yeah, sure. See, the liposuction is a very good option. It gives a very rewarding results for the lateral thigh area. But one more small the advice to the juniors who are all practicing, because a lot of juniors also watching the show. Not like other areas, thigh liposuction is to be performed because it has to be uniformly done. like tummy means we'll remove one area completely and we define it and we'll go move on to the other area. Thigh is not like that, because I see a lot of people come with the depressed areas in the after the liposuction because contour deformities. By better not to do the liposuction in one area fully and go move on to other area. You have to uniformly remove it. Don't remove the skin fat as much as possible, unless otherwise you want to tighten in few areas. Passing the cannulas under the skin is fine, but don't remove the skin fat. Okay, so definitely liposuction is very rewarding. Not only the lateral thigh, you also see a lot of people with the lipodystrophy, complete lipodystrophy of the whole lower body. Like the liposuction definitely is the best, providing the best results. Sometimes if you have a large volume, say you supposed to remove 12 to 15 liters of fat from only lower body, I advise to go in stages, because otherwise the skin, you might lose skin, because I have few cases where I lost the skin. I need to do grafting to correct it. So don't do at a stretch the lot of volume in one particular area. And one more thing is, like in our clientele, like I don't know about that Delhi and other cities here, the cost factors plays a major role, because sometimes, as Jayanti said, they want to go for the cool sculpting and combining the thermal and a lot of other things. When you see the cost factor, liposuction works out cheaper for the crowd. So sometimes, like if the middle class, they can't afford so much, sometimes we need to go the liposuction as a straight option, because they can't go for a multiple sittings. And sometimes even after the non-surgical, they won't be happy few times. So we need to go with the what do you call that, non-surgical option. So that time cost becomes very much. So sometimes, according to the we have to strategize, we have to understand the patient need, and then you have to go with the treatment modality.
Dr. Ashish, talking about liposuction for the lateral thighs, do you do it as a daycare procedure? How many days of downtime do you want the patients? When do they get back to work? When do they get back to the gym? Can you please tell us on those?
Yeah, sure. See, I don't look at lateral thighs as just a solitary area that is to be treated. I usually look at the whole circumference, or it could be along with the tummy, and then I'm treating the the abdomen along with the thighs. So in that case, my cases are they can be day surgeries, but I limit it to number of zones that I'm liposuctioning, not more than 4 or maybe 5 zones in a patient who's got a BMI of around 30. If it is more than 30 and if it looks like it's going to take a long time to do the whole thing, I then prefer to keep them overnight for one night. But the others, let's say hypothetically, if you're only doing the thighs, so you're doing the front, the side, maybe the inner thigh, these 3 areas.
Yes.
So as Dr. Karthik said, I mean, thigh is very unforgiving. If you do excess, if you just aim to remove the fat, then you are likely to leave irregularities, and the skin may not contract. The skin can become loose, and it's not something that patients like. So you have to do it judiciously. You have to contour it so that it looks proportionate and even, and you allow the skin to tighten, and then you can go back again and do it again if you want. But doing too much at one time can leave you with an unsatisfactory result. So shape it, get a lovely result on the table, and put the garment on and let the patient enjoy that result once the skin has tightened, and then you can take a call on whether you need to do it again.
So how many days later can they get back to the gym? I normally tell them that take it as your body recovers, give it 2 weeks time. If you don't have any pain, mild stretches, and then take it from there. What do you say, Dr. Ashish or Karthik? Do you have any specific instruction post liposuction with regards to starting their exercise and workouts, etc.?
I use the ultrasonic liposuction laser with power assisted, and these patients do tend to ooze a little bit longer. So in a week, probably you would have a dressing on, and after that week, another week of compression garments. So as you rightly said, maybe by 2 weeks or 3 weeks, I'll allow them to start doing stretches. I want that skin to stick down nice and firmly. I don't want shearing to happen between the skin and the underlying surface. You have taken the fat out and you want the spaces to collapse. So that's one reason why I don't ask them to start too soon. And the other reason I don't want them to get their blood pressure pumped up and the lymphedema, lymphatic fluid to fill that space. So I take it a little slow, but by 6 weeks, they can hit the gym and do whatever they want. I mean, they can go whole hog.
No, so my almost the same, but the thing is that thigh is the area where you see the results last as well as the recover last. So compared to the other areas, because the most dependent area of the body, the swelling will be more. If people keep coming, doctor, no results, no results. We have to clearly tell the patient at least 2 months for the results to come. So till that, actually the calls come till 1.5 months after the patient won't call you. That means that they got the results. Okay, so one more thing what I observed in my practice is the patient move early, any areas, not only the thighs. If they mobilize them early, they end up in a lot of ecchymosis, a lot of redness. So better to take rest in the first week completely as much as possible. After that, slowly move, as Dr. Jayanti said, your body will tell you what is next kind of. Your body will tell you how much you can mobilize yourself. So that is a clear thing what I say. But Dr. Ashish told a very clear, good point that the shearing forces matters a lot, because otherwise you end up in a loose skin. So better to go slow. But our patients are not, patient enough to wait. That's the problem also. Till that time they never hit the gym. But after the liposuction, next day they want to go to the gym. That's the common scenario what we see here. So. Almost all you covered everything. The same. Yeah. I also follow the same.
Yeah. So for the viewers, liposuction is a good option for reducing your fat on the lateral thighs. And what we highlighted was you need to wear the compression garment. Dr. Ashish touched upon the devices that are used, either power assisted, ultrasound assisted. Devices used for uniformity and skin tightening. One last point I'd like to include is when we do liposuction of the lower body and you wear a tight compression garment, you can get a swelling of your legs when you start walking, and as well as your genital area sometimes. So I think you need to watch out for that. Don't panic when you do get swelling of your genital area after the liposuction, because it's a normal process and it will settle down in about 3 to 4 weeks. Dr. Ashish and Karthik. So I have a viewer whose question was, can I eat normally after tummy tuck? So there's a lot of confusion among the viewers between bariatric surgery and lipo-abdominoplasty. So Karthik, do you want to start with that?
If you ask me, they should not. Then the question, the intention is different. I understand the question. It's not that we are not shrinking the stomach size. It's not the bariatric surgery. But still, the mistake what commonly our people does it. Even today, I got a call. The patient clearly says, I don't have a time. I want to go for a tummy tuck. If the patient says that, I don't do the surgery. First, I have to educate her about the whole that intra-abdominal fat. You have to unless otherwise you reduce it, we won't even get a good result. We never tell the patient that you eat normally. It is not a good for any kind of body contouring surgery. But I got the point. The tummy tuck, what we are doing is we are just removing the excess skin and tightening the muscles. We are not reducing the internal stomach size. So the volume of the food what you take, you need not reduce at all. But the thing is, if you are not controlling your food and maintaining your weight, what happens is during the lipo-abdominoplasty, the tummy tuck, what we do is we do liposuction nicely the tummy. That is the fat between the skin and the muscle. Okay. So once we remove this fat and tighten the muscle, and you're not maintaining your weight, or if you're overweight, if you're not reducing the weight, what happens is the intra-abdominal, the visceral fat component bulge out. After the tummy tuck, if it happens, your tummy looks horribly bad. Don't expect everything for the doctor to do it. When you're planning for any body contouring surgery, first you have to discipline yourself. Otherwise, don't go for a surgery.
That's nice. Karthik, a strict warning that if they're not disciplined, they should not opt for liposuction. So that reminds me, most of the time, some patients who opt for liposuction are actually not candidate for pure liposuction because their BMI is over 40. So I know all three of us will agree that we don't
Sorry,
do like.
1 minute. I'll just release the dog and come.
Yes.
Sorry.
So all of us, we will not agree. We are not for liposuction of a BMI over 40 for mainly as a weight loss procedure. I think Dr. Ashish, what's your take? Because most of the patients who come with 120, 130 kilos, and they are looking at liposuction as a weight loss procedure because they feel that there are complications with bariatric procedures. So how do you handle this situation? I am not a fan of doing lipo for them.
Yeah, you're quite correct. See, I divide these patients into these two categories. So the one category is those who have a very high BMI. So what happens in them is they have usually generalized fat excess everywhere. But we have to remember that liposuction is a regional surgery. It will remove the fat only of the regions we suck the fat out from. So if we are treating the front of the abdomen, only the front is going to go down, the flanks, the lower back, all of these are regions that you have to treat separately. But in those who have a BMI of 38 or 40, they have fat on their upper back, they have fat on the neck, they have, everywhere. Then those areas, they still look bulky. Okay, they may get a central core. We could treat them circumferentially around their tummy, or maybe we could treat the thighs separately. But it's unsafe to liposuction so much. Usually there are some restrictions of how much suction one should do at one given time. You may have to break it into sessions, like doing it over two, if you insist that you want to do it only through liposuction. But the best is, see if you can, get into a good diet and exercise regime where you are reducing your fat percentage, your BMI, and then those resistant areas, you treat them with liposuction. That can maintain subsequently.
Yes. Yes, Karthik, you have
that's that exactly. But I have few other indications for the people, like the obese people, BMI around 30 to 35. Sometimes I take them for surgery. Sometimes I take them for gynecomastia correction, because even in your bariatric surgery, see, you think that you just we say that 35 BMI, they're going for the bariatric surgery, come back, they'll have a lax skin in the chest, and the whole thing will sag. That time correcting is little difficult, and we need to go for a all this procedures which leaves a scar in the chest. So what sometimes I advise is, before going for the bariatric surgery, I'll do the chest correction, so that the skin contraction is better, skin quality is better before the bariatric surgery. Then I'll put them and send them.
Anyway, that is what most of the boys ask. Even if they're 130, they have to get rid of gynecomastia, irrespective of how the rest of the body is.
Rest of the body looks.
That's Dr. Ashish, there is a general fear among the public regarding safety of liposuction. I'm sure all of us know that, because whenever they come, they opt for cool sculpting as a first choice because they are scared of liposuction. And I think it's using this forum, it's very important for us to tell who is certified to do liposuction, which body certifies us, what is the governing body, and how safe is this procedure when done right. I think both of you will I would like both of you to talk on that.
A very good point, actually, because there's so much information out there which actually creates a lot of fear amongst viewers. But liposuction is one of the commonest procedures globally in aesthetic surgery, and the history of liposuction is more than 40-50 years. It has evolved, and there are numerous successful cases, but it's just like in any other procedure. I mean, there are miscarriages or deaths happening even in C-sections and some other procedures which are very common. So if done wrongly, or if it's done if there are complications which are technical rather than actually procedure related, I mean, if it's not done by a trained surgeon who doesn't know where his cannula is going, then he can do anything. But there are other guidelines that are very well established by our association, our Indian Association of Aesthetic Plastic Surgeons, the American Association of Aesthetic Plastic Surgeons, and the International Society of Aesthetic Plastic. all of them have got nicely laid out guidelines of who are the candidates on whom you should do liposuction. And the most important is, yes, your BMI and your amount of fat and your exercise regime and all of that. But along with that, not to do unlimited and aggressive liposuction. You do what is sensible and safe. There are safe limits, and that's why you should follow the advice given by your aesthetic surgeon about breaking it into stages. It is quite tempting to say you want to suction everything from your body, but then if you
360-degree liposuction. Sorry to interrupt. This 360-degree liposuction.
360-degree liposuction. 360-degree from head to toe. Yeah.
I want request asking. I want whole body liposuction.
Yeah. But it's not.
No,
like
I used to get the request same way. Like a full body liposuction, full 360-degree liposuction.
Yeah.
Really
And it's not like you put a cannula somewhere at the toe and it's sucking out everything from the head down and it's out. It's not like that. So it is. You have to work on every part and remove and make it even. So you have to remove the fat, you have to make it even, and it has to merge with the neighboring area. So it's a lot of skilled work. But safety is, if it is done by those who are properly trained. And for that, the plastic surgeons, obviously, who have extensive anatomical knowledge of the body, they know which are the planes and where the fat is, which is deep fat, which is superficial fat, and where the muscles are. And then it's an extremely safe procedure. Its complications are usually perioperative and they are manageable. Bruising, ecchymosis, or swelling and numbness for some time. These are the common, things that happen but recover. But those who do it in very high BMI patients and who are doing long operative hours, 8 to 10 hours or more of suctioning, they are the ones. If they've not prepared their patient properly, they don't know the fitness of the patient, how well they will tolerate post-operatively, what is their hemoglobin like, and all those things. They are the ones who could land in trouble. So going to a surgeon who actually does a proper thorough assessment and then gives you the advice on what can be done is a safe procedure. I mean, there is no issues there.
Karthik, you want to add something?
Dr. Ashish covered everything. Only 2 points. The hemoglobin loss, it's more than what we assume. Actually, post-operatively, that third phase, mild leakage and all those things easily is, or normal example, 5 to 10 liters of fat suctioning, the patient lose 2 grams of hemoglobin easily. So when you're going more than that, obviously the hemoglobin loss is so much. So you have to consider that, because a lot of juniors, they don't see it seriously. Other thing is what we have seen commonly in most of the patients, mild diabetic, even though their blood sugar is under control, post liposuction, the blood sugar shoots up. So unless otherwise tight diabetic control, don't take those patients for surgery, because post-operatively you end up in, even I got one patient who was, recently diagnosed diabetic with the HbA1c is 10. We are a very, very bad time. So after that, we keep watching all those patients with, even people are, borderline cases, they are not diagnosed as diabetic, but those patients, obese patients with the insulin resistance, we see the high spike in the blood sugar after the surgery. So we routinely check the blood sugar in the patient undergoing a liposuction, mild to moderate obesity, though they are coming for the gynecomastia. If you do liposuction, because of few reasons, your adrenaline, the tumescent also tends to increases the blood sugar level, as well as the stress of the surgery itself. So blood sugar monitoring is the most important thing people have to incorporate in their practice of liposuction.
Thank you, Karthik. So the take-home message from this discussion, one of the important messages, liposuction is a safe procedure when done by board certified plastic surgeons. In India, you have the Indian Association of Aesthetic Plastic Surgery and Indian Association of Plastic Surgeons. You can check who are the actually certified plastic surgeons from those sites, rather than just believing, everybody who claims to do liposuction, because today liposuction is being done by many surgeons other than plastic surgeons as well. So it's very important that you get this procedures done from trained specialists, because when we are posed with the question saying that so and so died or so and so had a complication done out of liposuction, and sometimes it's very disheartening to know that it's not done by plastic surgeon, somebody does, and there's a complication, and because of that the whole procedure loses its credibility. Dr. Ashish, I would like to conclude with talking about calf reduction, because we started with double chin, of course, arm and calf reduction. I think Karthik will have arm and calf reduction. What do you do for calf reduction, Dr. Ashish?
I check basically if it is subcutaneous fat. Some have very big bones and they have got big muscle bulk, and that apart. But if their legs are really fatty, there is a condition called lipedema, and it's very important that we differentiate these patients, because they do really well from liposuction. They suffer from big fatty legs, and the legs get swollen as they stand. It's a little, they have a little sluggish lymphatic circulation, which actually contributes to adding fatty deposits in their leg. And liposuction is the only way in which they can reduce the size of their legs or calf. So I would treat the back of the calf and maybe the lateral side. You don't have to liposuction the front that much, but it's mostly usually the posterior and posterior lateral side of the calf, and you even it out. So I think, and then, but the compression garment, and as Karthik said, that they do suffer from a lot of edema later. So they need a long duration of compression, but they can get dramatic size reduction once they've had it done.
Karthik, you want to talk about arm reduction, Karthik?
No, adding to the lipedema, see, I have treated 3 patients till today, but none of the textbooks spoke much about the lipedema. Only that, like the patient brought the literature to me and made me understand. I think one patient from, I think African country, but settled in somewhere in Europe. So he's a familial also. So not only that posterior aspect, even the whole complete circumference, even the food and every areas are involved with the fat deposit. It's really difficult to do surgeries. I think 9 years back I did 2 surgeries, and very difficult. We took almost 3-4 hours for only the calf area, both sides, to finish it off. And these patients, Dr. Ashish, if you have any literature, please send it to me. I'll be very happy to read those things, because I haven't done much that time. Another thing, I do calf liposuction as selected patients, like when only the fat deposits. And even last week I got a patient coming with a calf muscle bulk. He wants to reduce. It looks very abnormal also. Then the Botox is the option, though it's a temporary, it gives a rewarding results. Other thing is selective neurectomy of the muscles described in the literature, but I have not done anything. But the patient wants me to do it. I need to do soon. And these are all the options available for the calf reduction. And second, the arm liposuction. Earlier days, the safest, the teaching is only you do the batwing liposuction to reduce the fat in that area. But nowadays, what most of the surgeons, what we perform is almost circumferentially one bit of area without disturbing, so that the drainage won't get affected. So it's a circumferential arm liposuction almost, except a small strip of area where there is not much fat. And then only the skin retraction is better. And even like some people, if they keep the arm like this, there is a bulge forms in this area. Even our patients are very concerned about it. Not only that, this position also patient has to be checked for the fat in this region, and all those areas, skin retraction is very good in most of the cases, except that very much, like that area, the skin where it connects with the armpit, that area they might end up in little loose skin issues. It has to be addressed in the future with the all skin tightening procedures, because most of the patients whom they're coming to us are not very mild liposuction candidates, little bulky patients whom, like we are confused whether to go for arm tech or this kind of a thing. Like we want to try, because arm tech, we want to give a big scar in our Indian clients. So even those patients, the skin retraction is very good, except the little loose skin in the armpit region. If they are okay with that, probably we can do a liposuction.
Yeah, because my experience with cool sculpting for the arm, so there are patients who opt for cool sculpting. They require multiple cycles, multiple sessions. Again, the cost factor is very something to be considered all the time. And so, even after that, some of them are not happy, but some of them who have just very thin pinch or the flat with loose skin. I think a combination of cool sculpting with thermage will give some benefit. They can do. It's very important that the viewers understand that we will not have another procedure if a non-surgical option is going to deliver the same result as a surgical option. So the non-surgical will give you some results, provided you're ready to accept those results. The surgical has minimal risk, but can be done with when done carefully. They are very, very safe. Of course, they are much rewarding, and the results are far better. Uh, I do have patients who come and ask me liposuction for the cheek. Doctor, I normally don't do liposuction for the cheek. I prefer to give injection if at all it's required. What is your experience, Dr. Ashish? Do you do liposuction for the cheeks?
Yeah, I have done. I have done for a few, but I would first ascertain, make sure that it is subcutaneous and suppress mass fat that is adding to the bulk in the face. The buccal pad of fat is one option that I would first consider removing, but removing the buccal pad of fat, which is around here, would just reduce this by about 5 grams or so. But these people have huge amount of fat which is coming down and then almost merging with the under chin fat. Just doing this, if you just do the under chin liposuction, then their face becomes very compressed. I mean, they become wide here and vertically compressed, so it doesn't make them. So you have to think. So what I do is I draw a line from here to the angle of the mouth, and then I suction from here down and go to the opposite side. So
Okay.
it's that helps me in keeping, and I stay superficial. I don't use any deep probes, and it's just going to be a subcutaneous superficial reduction, and it helps the skin to tighten as well.
Nice. Karthik, your anything? What do you do?
I won't do a liposuction above this area because I had one bad experience in initial days of my practice. For a model, I did liposuction of this over this area and small dip, like dip here. That time fat transfer, I'm not very familiar with. I don't know why I haven't suggested fat transfer, but it's really the not a good experience for me. So I don't do above this area. I do buccal fat pad removal, as Dr. Ashish clearly said. Their expectation is different, but to clearly make them understand only this area goes in. Other areas, I always try to manage with the non-surgical options like a radio frequency and ultrasound-based machine. That really works well. But I have seen a lot of people now coming up with the flattened cheekbone area because of the overdone non-surgical the procedures. You have to instruct the person who is doing the non-surgical procedure clearly, saying that this area you should not address and where are the areas you need to address, because obviously none of the doctors will go and do all those procedures in all the patients. Obviously, when you are giving a technician the job, you have to make the technician understand which areas you should not touch, and you have to review the photographs with the technician to make them understand, okay, this thing, when here you will make it flat, so you don't touch this area, go other areas. This kind of the reviewing the results with the technicians really matters a lot in giving a good results in non-surgical area.
That's really nice. So we've been talking about fat reduction. I think before we conclude, we'll talk a little bit about fat grafting or addition of fat to some areas. So when somebody is going on a strict diet and exercise program, and of course you're losing, there's a massive weight loss. You lose not just in the areas that you want, but areas where you don't want as well. Actually, you lose a lot of fat from your face and area where it makes you look drawn down or sick kind of an appearance. And today, regenerative medicine, meaning fat grafting, is taking a upper hand in most of the practices, and the techniques are being refined, and the survival of the fat is becoming better and better. Dr. Ashish, would you like to take us through fat grafting? What are the indications that you do? What kind of clients that you get, and what's the procedure that you follow, and so on?
Fat grafting is a revolutionary development of the 20th century. In fact, it's just like skin grafting was earlier. Similarly, fat grafting has been showing such marvelous results and has got so many vast applications now that aesthetic plastic surgeons, it should be their a tool in their armamentarium for sure. And as you rightly said, that when you lose weight, the first area for the fat to go is your face, and the first area for fat to come back when you put on is your tummy. So the face fat, when it goes forever, and it makes you look older. So there is a particular age before which weight loss may be okay, but after a certain age, I don't recommend them to lose too much weight, because then they start looking older, and this sag and all those things happen in the face. Fat grafting, periorbital, I mean around the eyes, is the area where you lose the fat from first, and eyes start hollowing in, and you start showing tear troughs, and you start showing deep grooves, and flattening of your cheek fat pad, and then the sag which happens. So all of those things can be corrected with fat grafting, and I do a lot of them, and this could manifest even at a young age, like mid-20s. I've got so many women who complain, say that they look tired. I mean, they're in the 20s, but they look tired because they have got a little bag underneath their lower eyelid. But that bag is not a fat bag. It is the normal muscle, eye muscle orbicularis. But it is loss of the fat which is underneath that muscle, which is called the SUF fat pads, suborbicularis ocular fat pad. So when that fat pad shrinks, you get hollowing, you get tear troughs, and your eyes start looking tired. And the same thing happens when the subbrow fat around here, that starts shrinking. That is called the roof fat pad. So there are fat pockets, very well defined fat pockets that we aesthetic plastic surgeons know about, and we can refill those fat pockets which are gone. If you clinically examine them properly, you can identify where the loss is, you put it back, and you can really make them look fresh and also youthful. So the fat that we put in, I say about 50% of what I put in survives. So I prepare my patients that half of what we are putting in is going to survive, which should most probably achieve the result we want. But there is a possibility that it could be undercorrected. It's rarely overcorrected, but a little undercorrected is also fairly okay. And rarely, very rarely in my hands, at least, I mean, I have had very few requests, but you could have to refill, do a fat grafting once again. Just be mentally prepared for that.
Karthik, fat
Dr.
grafting.
Ashish covered everything, because I do understand that time is almost over.
Yeah.
He covered everything, and the 50% that take the patient has to understand. Even for me, the second fat fill is very few. People won't come back, though I do the second surgery almost free of cost, only the hospital charges, but still nobody comes back, because that means that they don't want it. And sometimes I do it at a local also. I do it most of only the tear trough fat fill I do it at a local, and only one area fat fill I do it at a local. And it works. It's easy also nowadays. I feel it's comfortable than the anesthesia, because we have to check the vision sometimes, so it's easy to give the fat and then check the vision. It's easy to do it at a local. And various indications, even sometimes I've done one case, just to dorsal augmentation, I use fat. It really worked well. Almost 2 years follow-up, it's really good. And we a lot of new indications we are finding out for the fat. Almost
Karthik, I really agree on that dorsal augmentation, nasal correction. So when there is a need, sometimes just on the inner arm, give some local anesthesia, take some fat, and then use it just like a filler. So instead of the filler, the fat filling for whatever the same area, actually the results are far better, and it's more long lasting. So nowadays, even a little bit of where there is an indication for nasal filler, I normally use fat instead of filler. I've started using fat for nasal filling as well as
gives some
for
confidence to. It gives some confidence to use it in more patients.
Yeah. So I've done a couple of
fat is more cheaper than the filler nowadays. Like if you calculate the charges, what fillers they are going to charge, the fat will work much cheaper for the patient.
Anyway, I think we are on time, Dr. Ashish, Dr. Karthik. Thank you very much for joining us in this 4th episode of Self-Love Recipes. That's how I call it. And I think our viewers, Dr. Ashish Bhakta is practicing out of Pune. I'm sure if you just Google his name, you'll find his clinic. And Dr. Karthick Ram is RO from our own Chennai. So we are all accessible. And if you have any question, please send it to us and we'll be happy to answer. Thank you very much, Dr. Ashish and Dr. Karthik.